One of the procedures that we perform at Good Samaritan is chest wall reconstruction, and the purpose of the procedure is to regain the integrity of the chest wall. Patients are being seen by their primary providers. They are diagnosed with some disease, or in some cases patients are coming to emergency room after trauma, and we see them, we schedule them for either elective or emergency surgery. One of the most common procedures that we do is a repair of the fractured bones. Patients after trauma, after falls, after car accidents, they come with fractures in the ribs. The procedure starts preoperatively by sophisticated imaging. We get a 3D CT scan of the patient. In some cases, we create a 3D model for visualization and simulation of the procedure. We reconstruct the integrity. We stabilize the chest cavity with plates, the procedure that we call rib plating. In other cases, the problems are malignant tumors with invasion to the chest wall structures. This is a tumor which does not need to be here. It has invaded the chest bone, and in this case, to treat this problem, we have to remove part of the bone. With removal of the bone, we are losing the integrity of the chest cavity and causing significant malformation for the patient. To treat this problem, we are creating a new structure in the chest. We are restoring the integrity of the chest and the chest wall with building the whole structure, the bony structure, from artificial materials. In cases of rib plating for rib fracture, usually the patients go home the same day. They recover at home. In larger cases, when there are reconstruction of the larger pieces of the chest, such as multiple ribs or the chest bone or clavicles, these patients stay in the hospital for 3 to 4 days usually, and then recovery takes about 3 to 4 weeks back to normal life and normal functioning.